Good evening, it's Dr. Adam Nally coming to you live on a Monday evening, the 6th of April. It's been a long day. I don't know about you, but it's been a long day for me. But I thought I'd just talk a little bit about one of the questions that actually literally came up 3 times. I think it's coming to my office in threes. Today it was blood pressure. I had 3 people come in with blood pressure issues or talk to me via telemedicine, via their blood pressure issues going, I don't understand why my blood pressure is high. And so I thought tonight we'd just talk briefly about how blood pressure goes up, what causes it to go up, and how you can lower your blood pressure in a natural way with a ketogenic diet. I'm amazed at how effectively within literally 2 to 4 weeks, people's blood pressure is normal when they follow an appropriate ketogenic lifestyle. And so I thought we would talk about the mechanism behind that and how it works and how it can help people do that. So I figured that you might find that to be a benefit. My phone is buzzing me here. Anyway, so that's the story. I thought I'd briefly talk about that and maybe answer some questions about all sorts of exciting things that are happening in the world around us. So anyway, excuse the pages and the tings and all the things that are going on, the dogs in the background and the cats. You may see cats walk across here. And I wouldn't be surprised if you see a goat come through. So anyway, blood pressure. What happens with blood pressure? Well, blood pressure is not driven by necessarily hard arteries. The arteries, not until way late in the game do arteries become hard enough that it notably lowers the blood pressure or raises the blood pressure. Blood pressure is driven not by salt either. If I have patients who restrict their salt, their blood pressure will only go down by 5 points. Most patients that come into my office, their blood pressure is in the 160s, 180s, and it needs to drop by at least 30 or 40 points. And so cutting out salt does absolutely nothing. And in fact, there's a couple studies that show that if you cut out salt, your blood pressure goes up, not down. So the challenge can be that you may find that blood pressure is hard to control if you're focused heavily on salt. So what really drives blood pressure? Well, there's really 2 factors that drive blood pressure. And the first is the liver. Your liver, as we've talked about in the past, controls your blood sugar, but your liver also, in the processing of fructose, actually raises your blood pressure. And so I'm going to show you here for a moment. This is my slide here, and this is one of my slides from one of my lectures. And what I want you to see, and I hope you can see my mouse here. So fructose right here is metabolized in the liver, and this is the liver. And in its process of metabolism, it produces a couple byproducts. It raises the glucose level itself later after it's been processed. It raises uric acid, and so for those of you who have gout or kidney stones driven by uric acid, it's caused by the fructose metabolism or alcohol. Alcohol and fructose are metabolized almost identically. Both of them produce an aldehyde. This fructose 1P actually converts into an aldehyde. And then they produce, the uric acid lowers nitric oxide and raises blood pressure. And so that's one of the big challenges that arises with this, is that uric acid also leads to the production of gout. In kidney stones, it raises your triglycerides. That fructose 1P byproduct of fructose pushes that up and actually causes hepatic insulin resistance. And so a lot of what we see in regards to problems in my office are actually driven not by salt, but they're driven by the metabolism of fructose. Now, why is that important? Because a sugar molecule is one molecule of glucose and one molecule of fructose. And so it's important to understand those 2 molecules. 100% of 80% of the glucose is metabolized in the bloodstream, but 100% of that fructose right here is metabolized in the liver. And that drives the process of uric acid going up, drives the blood pressure down, increases risk of kidney stones, and causes all those exciting things to happen. Now, one other thing that's important, and maybe I'll just put this up here. So number 1, fructose raises uric acid. I'm going to put that there. It lowers the nitric oxide, and we'll just summarize this in a fun little way with text on the screen right here, and it raises the blood pressure. Now, the one last piece that's important that's unrelated to the liver is that this high insulin response, so you have insulin is going up because you've got increased glucose from the fructose itself, and if you ate table sugar, the insulin goes up as well by itself, but insulin goes to the kidney, and I don't have a picture of the kidney here, but insulin activates a sodium channel in the kidney and causes the kidney to hold on to salt. So now you have nitric oxide, which is causing your blood vessels to constrict, and the blood pressure goes up. And then you're actually retaining more salt, and water follows salt wherever it goes, and so the blood pressure goes up. So you have this double whammy coming from table sugar or high fructose corn syrup. So simple process, literally within 2 to 4 weeks of cutting out simple sugars in your diet or fruit juices, which drive this process as well. I'll see people's blood pressure normalize to the point where I have to take them off their blood pressure medicines or literally cut them in half or to a third in order to lower it. Now, in some patients that are highly insulin resistant, it may take a little longer because that insulin level keeps the blood pressure staying high for a while. And as the fat cells shrink and as they lose weight, they'll see that blood pressure fall. The excess stretch on the fat cell drives the process of that overproduction of insulin and drives the process of that kidney to retain salt. And that takes sometimes a little longer than 4 weeks, but that's the thing that's what I see. So that's your simple 5-minute blood pressure lecture. Let me take this off of here so we can hide it and say hello to folks out there. So hopefully that helps with blood pressure and some of the things that you see and some of the things you worry about. And that gives you some insight into what's happening in that regard. Anyway, so let me see here. We've got Cheryl and hello, Cheryl, and hello, Everett. And Vicky's here. Let me just see if there's any amazing questions. Loving you in Shreveport. Thank you, Crystal. That's very kind of you. Hey, Terry, it's good to see you. And it was a rough Monday, Luz. It was long and rough, but I'm here now. All right, Dr. Nally from Brisbane, Australia. Catherine and Jonathan Geiser. Oh, cool. How are you guys? It's good to see you. Hello, Phyllis. And Jonathan says, loves your talks. Never too long or boring. Thank you. I appreciate that. Howdy from Texas. And Tawana says, my burger the burger was delicious. And the bacon was cooked to perfection. My wife has perfected bacon in our we've been married 28 years now, 27 years. She's going to kill me. I forget how many years we've been married. Don't tell her that. I'll be in deep trouble. I'll be sleeping in the doghouse tonight. Anyway, she's perfected the art of cooking bacon to perfection. So anyway, Cheryl is waving. And Angelique, how are you? Long time no see. Hope you are well. It's good to see you. Are you on the West Coast or the East Coast now? I can never remember. Let's see. There's Cynthia, pardon me, from Missouri. Awesome. And there's Gail and there's Eric. Hey there from Michigan, Eric. How's Michigan? I hope it's not cold there. And have they locked you guys down? I hearing some things from Michigan. What about the alcohol? So alcohol does the same exact thing. So alcohol and fructose. That's a great question. I didn't point that out very clearly, Linda, did I? Or Danny, pardon me. Alcohol and fructose are metabolized identically. They both produce an increase in the uric acid. They both decrease the nitric oxide, and they both raise the blood pressure, cause gout, raise the kidney stone risk, and increase the risk of triglycerides being elevated, as well as hepatic insulin resistance. Hello, Linda. How are you? I wish more people would listen when I try to share this information with them. You know, Linda, it's hard. People get stuck in what they love doing. We're all stuck in our ruts, and sometimes it takes life changes, like giant viruses, to get people to listen. And sometimes it takes more than that. Sometimes it takes life changing, altering events to do it. That did look good, didn't it? Let's see here. Chattanooga. Hello, Bindi. How are you? Let's see. Angelique says, good to see you doing your thing. Oh, yes, I love doing it. It's actually a lot of fun. It's good to see you. I hope your boys are doing well, Angelique. Give them all a hug for me. Let's see. There's Peggy and let's see. The West Coast in California. Okay, good. All right. I couldn't remember. So Cheryl says she's still strict 20 grams, but my stress levels are way up, so I'm gaining some weight. So Cheryl, we talked about this before. When you're feeling stressed, how do you solve it? You got to burn off that stress because you're producing adrenaline, norepinephrine, and cortisol. And the only way to do that is to actually go take a walk or ride a bike or pretend like you're being chased after by a bear and run from the bear or fight the bear. Anything that you're going to do to get that exertion up will actually burn off that stress. Is the big key. Jojo lost 178 pounds in a year and a half. Holy cow. Went keto to carnivore, dealing with psoriasis, Hashimoto's, thyroid. So the relationship of psoriasis and Hashimoto's, yes, absolutely. They're both driven by insulin. And so if those have not calmed down, one of the things I commonly see in patients with both psoriasis and Hashimoto's is that the insulin levels are still high. And so there's some things that we need to be focused on, like looking at normalizing that insulin more effectively. Sometimes carnivore does that, sometimes it does not. The challenge is oftentimes carnivore may actually produce too much of an insulin response and may kick you out of a ketogenic state, which was what's helping the psoriasis component of that. Hashimoto's is driven by autoantibodies in the brain, and there's some. And I actually, you know what, Jojo, go to my website, docmuscles.com, and I just posted a thyroid info page. On that thyroid info page, if you click on that, it'll send you a free email that tells you the protocol that I use with my patients, because I often don't have time to talk about it. So I've got an email that shoots out that gives the 6 supplements in regards to protocol that diminishes the thyroid antibodies within about 3 to 6 months. I was shocked when I first heard that this would work, and I've tried it with I think 90% of the patients that I've used this protocol with, their autoantibodies have either diminished to normal or have dropped to a third, and they actually feel tremendously better with the Hashimoto's or autoimmune thyroiditis. So go to docmuscles.com, click on the link that says thyroid info on the little the menu bar. I just put that in over the weekend to try to provide information for patients that wanted to have that, because I have so many people ask about Hashimoto's and how they can approach it in a way that's effective, and this actually is really effective. So check that out. Hopefully that may help that part of it. And if your mitochondrial dysfunction is off, which it often is, that may be one of the factors in the persisting psoriasis that I commonly see with a lot of people. If no more edema on atenolol meds, is it okay to quit the water pill? Well, Rita, I don't know you specifically, so it's hard to answer that question, and I can't give you medical advice over the internet. But what I can say to you is if your blood pressure is improving, and your edema has dropped down, talk to your doctor about backing off that water pill, because there may be other reasons your doctor has you on that water pill other than just edema. We use water pills for a number of things. So my suggestion is talk to your doctor about it, so you know what the goal is and where the end point would be in regards to using that water pill. Hello from Missouri. Hey, Dennis, how are you? Denise, pardon me, I did that again. North Carolina, Beth, there she is. Katie from Texas is here. Do I ever indulge in sweets? Gail, I never indulge in sweets. Not once ever. I'm lying. Yes, occasionally I will, don't tell anyone. Occasionally on birthdays or anniversaries, I will indulge in C's chocolates. But I pay for it for the next 3 days. I always do. So it has to be a really good reason to indulge. And to be frank, in the last year and a half, I just haven't had the craving to do it. And there's actually a pound of C's chocolate in my freezer, and I've known it's been there. And the craving, because I know what happens when I do eat it and how bad I feel for the next few days, I just have no desire. But I've been doing this again 16 years. So after a while, it just disappears, because when you cheat and then you feel that horrible carb hangover for 3 days, and it happens to you enough times, you just kind of go, I don't want to do that anymore. All right. Enjoy Facebook Lives. Thank you, Pam. Let's see. Hello from South Carolina to Charlotte. Thank you, Angelique. Oh, the boys are great. Awesome. We'll give them all hugs from the Nallys. I hope they're all doing well. Tell them not to give their mom too much of a hard time. Let's see. No blood pressure meds for 2 years. Low carb gout is gone. Awesome, Crystal. That's fantastic. I love to hear that. That is a true ketogenic moment. I love it. Good morning from sunny Cambodia. Well, Karen's back from Cambodia. How are you, Karen? It's good to see you. 80 grams of fat is a good number for 13 ounces of protein. I would have to look at the ounces. I can't remember. If it's red meat, it's usually close to 1 to 1. So if it's 13 ounces, it's probably close to, 12 ounce. If it's a 12 ounce ribeye, a 12 ounce ribeye is about 45 to 50 grams of protein. So if it says 80 grams of fat, I don't know if that's correct, Sue. I'm not totally sure what cut of meat you're referring to. This is actually Vicky that posted that up there. So I'm not totally sure there, Vicky, how you got that calculation. What's carnivore? Only meat. Yes, it's only meat, no vegetables. Carnivore is literally, if a lion doesn't eat it, you don't either. That's really what carnivore is. I'm about 90% carnivore. Today, as you saw that meal, the cheese on there is not considered true carnivore. It's kind of a variant. And I actually did indulge in a little bit of salad that my wife made. She made a Caesar salad, and it called out to me, so I had a little bit of salad. But I don't normally do that. About maybe once a week, or maybe once every 8 or 9 days I do, but not very often anymore, because I actually find that I don't actually feel good if I do larger amounts of vegetables. Nothing worked like keto did for high blood pressure, gout pretty quick too. Yep, that's awesome, Ruth. It still works. Great topic, says Adam. Oh, thank you, Adam. I appreciate it. Hope you are doing well and your family as well. Let's see. Hello from Dubois, Pennsylvania. Dubois. I always want to say that one wrong. Listening because my stepdad has high blood pressure. Well, Lynette, there will be a quiz at the end, so I want you to memorize everything I told you. Hopefully you did. And if you have questions, ask away, please do. Why would my kidneys be leaking protein? Oh, Aaron, that is a wonderful question, one in which we addressed at great length in my book, The Keto Cure, which is this book right here. So we talk about hypertension in here. In fact, if I flipped the page on hypertension, just show you this really quickly here. Where did it go? It's almost there. Oh, I just went past it. Let's see. We talk about the 16 different diseases. So I don't know if you can see that liver picture is kind of like the liver picture I just posted up there. And so now kidneys, different issue altogether. The high insulin actually damages the filtration system of the kidney. And it's kind of like, I tell people like this, you've got your screen door on the back of your house and you're shooting a fire hose with high pressure through that delicate screen door. Now the screen is just strong enough to hold the pressure, but if I pour honey into that high pressure, as it hits that screen, it punches that high pressure punches holes, and then you start leaking protein through the screen, so the screen no longer works. Now, if I pull the sugar back, the body will try to heal that screen up, and it can for a while, but after a while, there's enough holes punched in that screen because of the high sugar that's in that high pressure kidney that filtration system stops working. Now, that's a very simplified explanation because the kidney's system is really, it's kind of a unique system. The kidney takes everything in the kidney and dumps it into a bucket and then picks out what it wants and throws the rest out. Well, the ability to pull what it wants back is diminished by the insulin and the inflammation that occurs by the high insulin. But if you think about it like a screen and high pressure, it makes it easier to think about. That's essentially what's happening. When you back the sugar off, we see improvement in that protein, and I do all the time. I've had patients with protein, normal microscopic protein, we call it microalbumin, should be less than 30 nanograms per deciliter. I've had patients that have 2,600 nanograms per deciliter, and anything higher than 25 to 26, you start looking towards dialysis. I've had patients reverse that all the way back down to 50 with a ketogenic lifestyle alone and maintain that for years. And as they start cheating again, the protein gets worse again because that kidney gets damaged by the high sugar. So just like the blood pressure is affected through part of the kidney system, protein in the urine is affected as well. And it's all driven by the inflammatory changes caused by high insulin in the kidney. So great question. High blood pressure runs in my family. Hoping keto will make a difference. Sharon, I know I more than hope. I know it will. If you will do it right and you'll follow the correct ketogenic diet, it will be dramatic. I've had nephrologists literally come and sit in my office saying, "What are you doing?" Because our patients are getting better. And I basically say, "I'm giving them bacon." And at first they don't believe me, but then as I show them data of patients that I've been doing this with for 16 years, they're just blown away by it. So it's actually impressive. Do the supplements for thyroid work for MS also? MS, multiple sclerosis, is a completely different bird. It is an autoimmunity disease, but yes, it decreases some of the autoimmunity that's present. Now, we know that keto dramatically has helped. I have some MS patients that have been put into remission. I have 4 of them. All 4 of them have been put into remission to some degree when they do a ketogenic lifestyle. Now, not all of them have maintained that lifestyle, and those symptoms seem to come back. But those that have maintained their keto have not had exacerbations, or if they did have an exacerbation, it was very mild with their multiple sclerosis. So Kimberly Joe, it's one of the few things that I know that's been able to back people off their medicines with MS. You are very welcome, Jojo. Hopefully that helps. What is white coat syndrome a real thing? And how do I convince my doctor it's just situational hypertension? All right, Eric. So white coat hypertension means that when you walk in the doctor's office, white coat hypertension is kind of like post-traumatic stress. At some point in time in your life, you experience something scary in a doctor's office and your blood pressure goes up when you walk into the office. The way to determine, the way to prove to your doctor, this is how I have my patients prove it's either white coat hypertension or it's not. I have them bring their blood pressure cuff, their automatic cuff from home into the office, and we use their cuff, and then my staff uses our manual cuff, and we check the blood pressure. And as long as the two cuffs are fairly close, real close, then I know that their cuff is correct. So then I have them go home and I have them monitor their blood pressure for 2 weeks, every day or twice, 3 times a week, and then bring those records in. So I know they have a cuff that I can rely on. Then I look at their pressures at home. And if their pressures at home are normal, then I know, hey, they're actually fine. And that's how I determine if a patient has white coat hypertension or not. Because then when they come back into my office, their blood pressure is 20 or 30 points higher than it ought to be. That helps me understand this is just a white coat issue. It's a psychological stress response that happens when I show up in my white coat. So I stopped wearing my white coat for a long time until recently with this wonderful pandemic. I started wearing it again so I don't get cuties on me. But that's another story. But that's how you help people understand white coat. And that's how I identify it. And that's how I demonstrate that the person has normal pressures at home versus in my office. Hello from Seattle. Thanks for the info. You're welcome. Sharon. Joint instability from Ehlers-Danlos has never been better. That's fantastic. Sharon, you're not alone. I have a lot of people with Ehlers-Danlos that have told me that their joint aches and pains dramatically improve. Not completely resolved because it's a genetic issue, but it's notably better. Awesome info about the thyroid. Oh, you got it. Oh, good. Gail, go get it. Hopefully you're going to check it out. My mom has it. Her pressure goes sky high at the doctor's office, but it's normal at home. And again, Lynette, that's classic for it. Hello, Mark. Good to see you again. C's are the best. Oh, yes, they are the best candies. They really are. But we're talking about keto. So don't tempt all my patients. I'm not mad at you for that. That's funny. All right. Julia says, I am in Chicago. Wish you were my PCP. Well, Julia, you're always welcome to move to Phoenix. I have patients that have actually done that to have me be their doctor. And I'm grateful for that. I didn't ask them to do that. They just did it on their own. Locked down in Washington. Oh, brother. Let's see. Iowa here. Love these talks. Hello, Jennifer. It's good to see you again. And Belinda's back from Mississippi. Where can I obtain your keto ice cream recipe? It was actually written by Maria Emmerich, the Wonder Woman of keto. And let me see if I can see. There is an amazing, where did she put it? The ice cream recipe that we use. Where did it go? Oh my gosh. I'm actually flipping through the pages of my book as we speak. Oh man, where did it go? Hold on. I know it's in here. Let's see. Where did it go? Oh my gosh. Where did it go? There it is. Look at this image. That is keto. Maria Emmerich made that. She designed that recipe. It is heavenly. Heavenly. Some of the best ice cream I've ever had. If you see Maria Emmerich, give her a kiss from Dr. Nally, because that ice cream recipe is one of my favorites. I could live off of it, but she did a great job on it, and I appreciate her doing that. It was very, very great of her to do that. Where are we at? You see, we're on the ice cream recipe. Where did it? Uh-oh, I lost my place. Somewhere in here. I got so excited and we lost our place. Let's see. Where did it go? Where did the ice cream recipe? There it is. There's Casper started keto. Washington. Okay, there it is. So started keto in August, lost 53 pounds, finding myself moving more towards carnivore. Anything I should keep in mind after surviving a STEMI 5 years ago? 3 bypasses, gotten rid of all the stressors, including 30 years of shift work. Beth, for my patients who have gone through heart disease, intense keto, be strict. You have to be strict. A good exercise program, good stress reduction, and a good supplement. And I designed my Keto Essentials multivitamin, which I take personally myself because I wanted all the pieces that should be there that help stabilize that blood sugar even more than what I can always get through my diet. So that's what I tell my patients and recommend there. What does a carb hangover feel like? A carb hangover feels like you were hit by a bus before you got out of bed the next morning. To me, I literally feel like I was run over by a train, and then it backed up over me a second time. I feel every muscle in my body hurts. Every joint in my body hurts. I feel like I don't drink, but I feel like I was drinking the night before, and so I have a headache. And I'll usually wake up at 3:00 in the morning with a massive headache, and then my body aches like crazy. And it's like, oh, I should not have had that. Should have not done that. Seized is good keto for almost 2 years. Feel really bad when I do. Oh, Seized is good. Oh, keto for 2 years. Feel really bad when I do. Hard lesson. It is a hard lesson. It is. All of us cheat. It happens. But you learn after a while to decide, do I really want to cheat? Right here in Surprise. Hey, Michael, how are you? Can losartan cause me to be lightheaded when standing up? Yes, any blood pressure pill has the potential to make you lightheaded when you change position or stand up. And if your blood pressure is getting better because you've been doing keto, then you need to chat with your doctor about lowering the dosage, adjusting the dosage so that your blood pressure is not bottoming out and you're getting lightheaded and passing out, because that's always poor form to pass out when you stand up. 2 weeks of keto, arthritis pain almost completely gone, off meloxicam for a month. Bipolar symptoms are gone. Oh, that's awesome, Lynette. I love that. Love to hear that. That's fantastic. Hello, Deb. How are you? Should I worry about the fact that I take lisinopril for high blood pressure if I get COVID? So I wouldn't worry. For my patients who are on ACE inhibitors or ARBs, I'm not worried about them being on the medicines. However, if they get the infection, then at that point in time, I would stop the medicines, or the doctor will stop the medicines, because we know that it can amplify the symptoms, but I would not worry about it currently, because what's happening is if we don't treat your blood pressure, you're more likely to have serious issues than if we treat the blood pressure and control it. But again, we're treating the blood pressure with a blood pressure pill, but we also want to make sure we're treating it by lowering the overall insulin response by not eating sugar and not eating carbs, if that makes sense. You are welcome, Aaron. Let's see. Lydia, I'm assuming Clydine is texting someone. All right, from Australia, down 230 pounds. Oh my gosh, Darren, that is awesome. Congratulations, dude. That is amazing. Just read the Keto Cure. What amazing information. I wish the information you found and published would get through to more doctors. Oh, I wish it would too. But you know, Kayla, it's like turning a battleship very, very slowly. Addison's disease, could this cause a struggle in weight loss? Absolutely. Terry, if your Addison's is not under control, I guarantee it will make your weight loss difficult. Addison's has a whole other component of stress and cortisol and all those things along those lines that makes it very, very difficult to lose the weight. So you've got to work very closely with your endocrinologist in balancing those so you can get the weight to come down. What is up with lisinopril? So this amazing little virus called COVID-19 was designed, and I say that word with emphasis, because in 2015 we know that the coding around this particular SARS virus. So they were studying, they being a couple groups around the country, were studying SARS virus and different encodings that would make it more penetrable to the human lung. And they actually found that a specific coding would actually bind to the ACE receptor within the lung, which is the same receptor that lisinopril and ARBs work through, and could infiltrate the virus into the cell of every cell in the lung with this particular special protein coating. They identified that in 2015. Now, the question is this the same component? There's a lot of evidence pointing to the fact that it could be. We know that this particular virus enters the cell through the ACE receptor, and there's some anecdotal data from docs that are treating patients saying that if they left the patients on their lisinopril or their ARBs, that it made the virus progress faster when they got to a severe state. That doesn't mean that if you get the virus, you're going to be worse. It just means that if you hit severity, they need to back those off and use different blood pressure medicines to control it during that severe time, if that makes sense. Can you have insulin resistance and not have diabetes? Let me put it this way. And the reason I wrote the whole book about the Keto Cure is that insulin resistance is the precursor that starts 20 years before type 2 diabetes ever kicks in. Type 2 diabetes is really the fourth stage of 5 stages of insulin resistance. You go through those first 3 stages over 20 years. So insulin resistance is the underlying cause of type 2 diabetes. It really is. Can I recommend a supplement to help with cravings and appetite control? I recommend my multivitamin. That's why I designed it, because it helps with some cravings. There are other prescriptions that I write, but I don't have any other supplements other than berberine, which is another supplement that I recommend that helps with cravings and appetite as well. So a good multivitamin and a good berberine, both of those you can find at ketoessentials.com or ketoliving.com. Keto Essentials is the vitamin, berberine is the second one. those are my vitamins, but if you have one you like, great. I do recommend a good vitamin that has the components that are necessary, and we put those into my vitamin to help with that. I didn't want to be a vitamin salesman, but that's, people ask me all the time, and I have not found one that I like beyond that. Let's see, my A1C is 5.3, but I have extreme insulin resistance. Yes, yep, exactly. Thank you so much. Appreciate answering questions. And thank you, Kimberly. I appreciate that. Well, hello, Craig from Lake Havasu. How are you doing? All I hear these days is my friends stressing about their cholesterol total. How do I explain triglycerides and their need for this number as well as LDL? Patty, I don't know how to get people to stop worrying about total cholesterol, because total cholesterol is 50-year-old science that's worthless. It literally is absolutely worthless. If someone says, I'm worried about my total cholesterol, they need to go back and maybe find a time machine and go back to 1950, because total cholesterol does absolutely nothing, and it means absolutely nothing. And if you look at the 2018 British Medical Journal study, it actually shows that if you lower the total cholesterol, you actually lower your life expectancy. Those that have a higher total cholesterol with normal triglycerides actually live longer. So that's an important caveat that we have brainwashed people into thinking that their total cholesterol number is important. And I don't really, other than educating people one by one, I don't know how else to fix it. Would I recommend ketogenic lifestyle for Parkinson's patients? Absolutely, Julia. It's the only thing I recommend for Parkinson's patients, because we talked about Parkinson's in the book. Yes, she has some amazing recipes. I'm assuming you're talking about Maria Emmerich. Happy to see all the supplements I need are contained in your multivitamin. Yes, they are. Do you ever add any extras to your keto ice cream? Poppy, like what kind of extras? Occasionally I might put blueberries on there if I am in a blueberry mood, but that's about it. Angelique says, that's exactly how I feel. You know what, Angela, I'm running behind, so I don't remember what we were talking about on that part of it. You have to remind me. Roseanne Boston, it feels like a really bad hangover. Yes, it does. Can't eat carbs too often, not worth it. Nope, it's not. Hello from Chandler. That must be Morris. Let's see, Kathy says, wow, quinine and zinc. Do you recommend a supplement? Mark, I'm not sure. You can't get quinine any longer. They won't let us prescribe quinine, and they took it off the market over the counter because of some side effects that were happening with it. So I'm not sure what you're referring to there. For the multivitamin, should I take 6 capsules at once or spread them out? So what I usually tell people, Gail, if you're referring to my vitamins, I usually have people start with 3, 2 to 3 first thing in the morning with breakfast. If you tolerate those, whatnot. And the reason is because B vitamins, if you start them all at one time, can make some people nauseated. So I have people start out with 2 to 3 with breakfast. If they do okay, then I have them take the next 3 with lunch. That usually works nicely, because some people can't tolerate all that B vitamin initially in their stomach, and so as we work into it, it does well. Angelique says, "Oh wow," and I don't remember what we were talking about there. Just joined. Hello, Teresa. Oh, thank you. You're very kind. So for our keto 5 months, blood pressure went down. Oh, that's awesome. Love that. That is awesome. All right. Is it true that COVID-19 is more likely nasty effects of high altitude rather than pneumonia? You know, Jojo, it's interesting because a lot of the data that's coming out right now in the last week, especially from New York, is showing that this isn't really, that the ARDS is actually caused by respirator damage, not necessarily by the virus. And that the virus actually mimics high altitude sickness, or at least it looks a lot like it. The interesting thing is that high altitude sickness responds to zinc, and it responds to melatonin, because zinc and melatonin actually enhance the conversion of carbonic acid to CO2, which is what's broken in high altitude sickness. And what happens is when we give people zinc and melatonin, they actually get better. And then the medication like hydroxychloroquine and hydroxychloroquine, it helps a little bit with that as well, but it also suppresses the virus, and then azithromycin suppresses the virus. And they're looking at, there's actually a couple trials right now for acetazolamide, which we give to climbers who are going to climb Mount Everest to help them not get high altitude sickness. And they're looking to see if that actually helps them. I have not seen the data on that. I'm actually waiting with bated breath to hear what the results are on that, because my suspicion is that this is a virus that inhibits in some capacities carbonic anhydrase, which is the enzyme that converts CO2 from the blood into carbonic acid, and then allows it to pass into the lung, and then it's converted back into CO2 so you can exhale it. That carbonic anhydrase enzyme, it sounds like, is being inhibited, just like that. What happens in high altitude sickness. And then so what the secondary side effect of that is you get pulmonary edema, and the pulmonary edema causes a whiteout across the lung, which looks like pneumonia. And if you're not looking for it, you'll think it's pneumonia and then put the person on a ventilator. because you think they have a double pneumonia. And what ends up happening is that when you put people on a high flow ventilator, it actually damages the lung and causes ARDS in the process of trying to help them oxygenate. So there's this catch-22 that a lot of the docs are seeing because of that. And so a number of our really brilliant ICU guys are coming out saying, this looks like what I've seen with high altitude sickness, and it's responding to some of the same treatments. And so I'm looking forward to hearing, if there's some results from that, because it sounds a lot like that's what's happening. What I'm curious to know is that if this virus has a different effect to those in cities that are at higher altitude, if those people are a little better acclimated and we see less infection in places where people live at high altitude rather than sea level. All of the cities that have had the major problems have all been at sea level. So I'm wondering, and just this is the brain, I don't know, this is speculation on my part, if that may be different. Is it normal to stall for 6 months? I've been keto for 2 years. Yes, it is normal to stall, Denise, and there's usually a problem. Thyroid, female hormones, something sneaking into the diet that shouldn't be there. A number of those things. If you're postmenopausal, that's always the challenge. A lot of people tell me their hormones are great and they're actually not great. So I would want to check that and see, or make sure someone who knows how to check their hormones can check it and see. You are very welcome, Denise. Cholesterol and salt are the two big arguments people have with me about keto. And Lynette, it was the argument I was taught in medical school, but I found out 50% of what they taught us in school is wrong. We just don't know which 50% that is. And in my case, what I've found is that what they taught us about cholesterol and salt were absolutely wrong. And so that's why I wrote the Keto Cure, is because we were wrong and we have to fix it. I stopped my 20 milligrams of atorvastatin after starting keto. No longer have muscle and brain fog, which is a common side effect 40% of the time. Is there a need to continue CoQ10? CoQ10 helps with other antioxidants, or it is an antioxidant, and it helps with oxidation it helps prevent the oxidation of other molecules. And so it is beneficial to some degree, but if you're eating a good ketogenic diet, you probably don't need more of it. But however, if you have mitochondrial dysfunction, which we talked about with thyroiditis, that is one of the key factors that is necessary. Can you take your vitamins when fasting? I usually don't, because you usually want to take the B vitamin component with food, otherwise it makes you sick to your stomach. So I usually don't recommend it when you fast. Hormone levels are tested. Okay, cool. Are you worried about a COVID vaccine? I really don't trust the medical industry right now. Lynette, I am a big proponent of vaccines, but I'm a proponent of vaccines that have been time tested. I am not a fan of vaccines that pop out within 52 days of an infection arising, because we really truly haven't had time to test them long term and see what the long term side effects are. Like we have this there's a new vaccine out that treats HPV, and one of the wonderful side effects is something called Guillain-Barré, which is life threatening. So I am not a fan of jumping on the bandwagon immediately with a vaccine that hasn't been tested over some time. I know that's a different opinion than a lot of other doctors, but I've had enough patients with side effects that have arisen because of misunderstandings in regards to the side effects of vaccines that I'm cautious. I think vaccines are life-saving, but I also want people to be well aware of the risks and benefits of any vaccine they're given. So that's my perspective on that. What would you need to ask for in relation to hormone tests? So number one, Bobby, I would want to know if they're testing it, are they testing which of the 3 estrogens are being tested? Is progesterone being tested? Is pregnenolone being tested? Are both forms of estrogen being tested? Which form of progesterone and pregnenolone are being tested? And which of the 3 estrogens are being tested? Those are the and then are you testing DHEA? Are you testing cortisol? And is it a blood test? Is it a urine test? Is it a salivary test? If the doctor can't answer those questions effectively, you need another doctor. Most doctors say, yeah, I'm going to check your hormones, and they check FSH and LH, and they check a total estrogen. Absolutely worthless. Tells you nothing. 100% of the time, they'll be normal in most cases. Well, I should say 95% of the time, they'll be normal. Do all disinfectant wipes kill COVID-19? That really depends on the disinfectant, Nita. We know that Clorox kills it within 10 seconds. We know that an alcohol solution of greater than 65 to 70% kills it within 10 seconds. But anything else that's a disinfectant, I would look at individually. Is there enough zinc in Keto Essentials to do what we need? Zinc in the Keto Essentials, I have to look back. I think it's It's either 10 or 30 milligrams. I'm recommending somewhere between 10 to 30 milligrams of zinc. Now, zinc can displace magnesium. So if we put too much zinc in it, we can displace magnesium. So in our vitamin, if I remember correctly, we put in 10 because we didn't want to displace magnesium. So that's what's in the vitamin right now, and that's adequate. If a person gets ill, we will push that zinc level up notably higher. But the baseline preventative zinc dose of 10 to 30 milligrams is adequate. I had a hard time balancing hyperthyroidism, supposedly caused by a hot nodule, and keto. Lost too much weight, couldn't get sodium level right. Yeah, hopefully that got balanced, Roseanne. That's important. I am not anti-vax, but I also feel they're rushing it. And when I hope they can find a vaccine. I do, but I also know that there's a large amount of profit to be had if they can do one quickly, and that sometimes clouds people's judgment, especially when it comes to long-term effects of something that can play a significant role in your life. So hopefully that helps. You're welcome, Bobby, for the answer. You guys are asking good questions tonight, and I've been rambling now for 40 minutes. So I appreciate all the good questions. I hope I caught all your questions if you had one. Thank you for sticking in for 40 minutes. If you've been with me the whole time, I appreciate that. Let's see. Oh, and the ice cream recipe. You know what? That's Dina. I didn't realize that was Dina. I'm sorry, Dina. I was like going through the questions so fast and I lost the ice cream recipe. I hope your family is well there, Dina. So, I hope it's in the book. Is the one location I've been able to find there with Marie Emmerich on that one. All right. Let's see. Any other questions? Pop them in there. You guys are great. I know it's late tonight. Let's see. Love. Crystal says the JU. I'm not quite sure what that means. Not sure. All right. No vax until double-blind third parties. Yeah. You want a double-blinded study with it. You want to be able to have adequate time for animal and human testing trials. And so those all need, and then I often will kind of wait for 9 to 12 months to see what happens over that first year. That's often one of the things that I do. Now, if you have a pandemic that's killing people, then you may have to reconsider that and look closely at that. But that's, again, those are things that I use as a baseline for assessing the vaccine. Do I have a vitamin D3 and K2? I do not, because I often will use different doses of those, Charlene, and so I don't actually give, that's not in the vitamin, and I don't have one separately because I often will modulate that dose up and down depending on what I need. And if a person is eating enough leafy green once or twice a week, they don't need K2. Extra K2 is just making someone's boat payment, in my perspective, because if you have a leafy green salad 2 or 3 days a week, you get all the K2 you need. So if you want to buy someone's yacht for them, that's kind of you. But I don't think I need to do that for anybody. A little more serious than Friday night's chat. Each night is different, Gail. Some nights we just spiral right down the hill to panty liners, and tonight it's a little more serious. Hopefully it doesn't spiral. Let's see. How long should we do fasting for? Well, Michelle, that depends on how long you can handle it. I don't recommend doing fasting for longer than 48 to 72 hours. I don't see any benefit. And in fact, the thyroid suppression and the testosterone suppression that occurs after 48 to 72 hours is too great for my comfort. Because I treat so many guys with testosterone deficiency and so many patients with hypothyroidism that when you do frequent fasts of longer than 72 hours, you can have some permanent effect on testosterone suppression and thyroid suppression. And I've seen that in my practice. And the studies actually reflect that as well. So I tell people, a simple 16 to 18 hour fast or 24-hour fast is great. If you want to once in a while do a 48-hour or even a 72-hour fast once in a while, I have no problem with that. But doing them frequently beyond 72 hours can be problematic hormonally. So that's what I tell people. Afraid to leave the house till we get vaccines. Cheryl, just wear your mask and wash your hands. Don't let fear stop you from leaving the house, because the sunshine out there is actually tremendously effective on your immune system. If you remember back in 1919, after the flu pandemic, because they didn't have a vaccine, people were treated by taking them outside and putting them in the sunlight, and they got better a week faster than those that weren't in the sunlight. So don't be afraid to go outside and get a little sun. You are very welcome, Vicki. I think we all needed the Friday night chat. The Friday night chat was important. It was a de-stressor, and we might have another one like that. You never quite know. It depends on who's on here, the questions that get asked, and the mood that Dr. Nally is in. I did an 82-hour fast, felt amazing, was actually just fun freaking people out. When I don't have a problem once in a while doing something that you want to do, and I know people feel great with it. The only challenge I've found is that people do fasting and they come into my office going, I don't understand why my thyroid is going bad. And it's not working. And I fast 82 hours or 70 hours, 4 times a month. And so that's one of the things that I find. So they don't sound like Kermit the Frog. No. Fasting and praying. Yes. Now we are doing a 24-hour fast this Friday. So join me this Friday, Good Friday. I'm going to probably start sometime around 7 or 8 p.m. If it was a bad day, I might start at 9, depending on how late I get home from the office. But sometime between 7 and 8-ish, 7 and 9, I'm going to start a Thursday night. And then we're going to do a 24-hour fast to probably 7 or 8 Friday evening on Good Friday. So it's going to be a Good Friday fast and prayer. We're fasting and praying for those that have COVID-19, those that are fighting COVID-19, finding answers. So join us, please. That'd be awesome. The caffeine pill I cut up and take has cornstarch and dextrose. Can't drink Diet Coke. Any way to consume caffeine keto friendly? I'm not. I'm trying to think of another way you can get your caffeine if you need caffeine. There are other things that have. There are some. Sam's Club has some drinks that actually have. It's the knockoff brand of the American Ice that has guarana in it, which turns into caffeine. That's another way to do it. The white kitty, yes, the fluffy white Persian that walked by. You saw the kitty. All right, let's see. Julie says, "Me too." There was actually a picture on Facebook of the panty lighter Facebook. Yes, there was. I saw that, Vicky. Yes, I did. I'm just walking for exercise. Do I need to wear a mask? Charlene, if you're out and about and there's no one around you, I don't think you need to wear a mask. But if you're walking and you're passing groups of people that you don't know, then I would put on a mask. And if you don't like them, cough as you pass them by. I'm trying to get people to join on Friday. Well, good. Yeah, have people join on. It'd be great. Let's see. So glad to hear Kermit. Yeah, Kermit showed up. Yes, he did. What are the longest fasts that you recommend? I usually recommend a 16 to 24-hour fast, depending on how you feel. Those have been shown to be just absolutely adequate. Green tea. Do not drink it, Lisa. Green tea, black tea, and oolong tea all spike insulin all by themselves. Any tree leaf-based tea, green tea, black tea, oolong tea, have a tannin that raises insulin all by itself. Without raising blood sugar, and halts your weight loss, makes your psoriasis worse, makes your uric acid worse, all those exciting things. Tea, yes. Green tea, black tea, oolong tea. Excellent. Regarding fasting, Good Friday, yes, that's awesome. Why do they put dextrose in IV? Well, so remember, Kathy, in an intravenous line with an IV, people are often puking their guts out. And they've been puking their guts out for 4 or 5 days. So when you show up in a hospital and they put an IV in your line, it's a way to actually give you immediate fuel. So there's nothing wrong with dextrose in your IV because if the doctor's using it to try to make sure your cells have fuel to fight whatever you're fighting off. So it's not a bad thing. But you can also use lactated ringer that doesn't have sugar in it. And there's some other concoctions you can make that don't have sugar. If the doctor is not really worried about sugar, he'll take it out, but if he wants you to have it, he'll put it in. Sometimes doctors don't think, they just use the one that has dextrose because it's not going to cause a problem. But if you're diabetic and you're trying to keep blood sugar under control, it may affect your sugar levels, and then they end up giving you insulin to counteract it. So it can be a little bit of a catch-22. Hopefully, they're using it for a specific reason. Sunshine and the vitamin D cure. Yes, I rid my hypertension doing keto. That's awesome, Deb. That's perfect. Some Zevia flavors have caffeine. Most of the Zevia seems okay. Kayla, I haven't had a problem with most of the Zevias. I think those are okay. Fasting once a week, 12 to 24 hours. If you want to, I find that I only eat 2 meals a day. So to be honest, my last meal was what I ate about 7:30. You saw the picture of the hamburger and the cheese, and I probably won't have another meal until tomorrow around noon or 1 o'clock. And so that's often, how many hours that is. That's 16 hours. That's just natural for me. So that's natural. If you're doing keto correctly, you're going to have periods of natural fasting almost daily. Oh, I did not know that about tea. Oh, good. Okay. Well, now you do. You've been educated, Denise. You've been educated. What tea can you drink? You can do it. Herbal teas are fine. I should say fasting is once a week I should say. You know what? So hopefully that answers the question about the natural fasting that's induced by a ketogenic lifestyle. Hopefully that helps. When you fast, do you drink water? I do. Now there are religious fasts where you avoid all food and drink. There's fasts that are just generally naturally ketogenic fasts, which during those you drink water. That's just fine. So it really depends on the reason you're fasting and what your intent is there. The cola Zevia has caffeine. It's delicious. Okay, cool. I don't drink a lot of Zevia. I haven't really cared for the flavors, so I haven't been a big Zevia fan. Some people love it. I just haven't cared for the flavors. Are you a coffee drinker? I am not, Linda. I don't drink coffee. All right. Great questions, guys. Let's see. Okay, I think I covered them all. Well, it's been almost 50 minutes rambling on. Hopefully we answered your questions. Hopefully if you get good what's the word I'm looking for? If these videos provide value for you, subscribe if you're on YouTube watching this in the replay, or subscribe over here. Subscribe over there on Facebook so you get notified when I come on live. Usually what happens is I'll do these. Once it uploads over, I'll pull it onto YouTube, put it on YouTube, and then I usually pull it off the Facebook site and then bring the YouTube back over so people can see it on YouTube in one spot. So hopefully that'll help. Is monk fruit, let's see, I can't do the artificial sweeteners either. Some of them will cause rebound cravings, so you have to be careful, Teresa. Is monk fruit sugar better than stevia? No, it is not. Monk fruit is a fructose, which will raise your blood pressure and increase the risk of kidney stones because it is a form of fructose and it's metabolized through the liver. So I am not a fan. Now, not everyone has the same response to monk fruit. I can't use it. Half my patients can't use it, so I don't recommend monk fruit. Although I know the keto world just loves monk fruit, and they praise monk fruit like it's better than bread. It's not. Monk fruit is a form of a fructose. That's why it's called monk fruit. And it is not I'm not a fan of it. I've had patients that can't get their blood pressure down, and I found out they're using monk fruit. As soon as we cut the monk fruit out, the blood pressure normalized. So be aware of that. Root beer Zevia with heavy whipping cream is delicious. Oh, Vicky, you're making my mouth water now. All right. Gail says, good night. Good night, Gail. Appreciate you signing in and being with us. Appreciate that. I've lost 10 inches off my stomach. That's awesome. Well, Audra, if you're stuck, it's probably hormones. Fasting sometimes helps because it helps with shifting some of those hormones, but I would have your hormones checked with your doc. Did you say that tree leaves raise insulin? I did, Roseanne. Any leaf-based tea that comes from a tree leaf, which is going to be black tea, green tea, or oolong tea, will raise your insulin. Great nuggets. At least they weren't chicken nuggets, Mark. So hopefully that helps. Thank you for another informative evening. You're very welcome. Kathy, starting to get hungry late at night again. Oh, that's terrible. All right, guys, I'm going to sign off because I still have charts to do and try to finish up. And some of you probably need to go finish watching your Netflix binging, and others need to go to bed. And some of you are just waking up, like I think our follower in Cambodia, I forget her first name. Oh my gosh. But I think you just woke up there, right? All right, guys, I'm going to sign off. Remember to keep your fat high, keep the carbs low, wear your mask, avoid sick people, and pass the bacon. And we'll see you tomorrow night. Have a good evening. Good night.